Scenario assessments draw on qualitative methods to assess an outbreak.
Different types of qualitative assessments and modeling outputs are useful at different horizons. Scenario assessments are a type of qualitative assessment that can be conducted early in an outbreak and outline a range of potential outbreak trajectories over the coming weeks and months, as well as a prediction of which is most likely based on current information. A scenario assessment can rapidly scope possible outbreak outcomes in the coming weeks or months to help decision makers determine preparedness and response actions. Creating a scenario assessment requires an approach similar to risk assessment development covered in a previous video, including review of literature, ongoing or potential response activities, subject matter expert input, historical data, and consideration for uncertainties or factors subject to change. Scenario assessments can also incorporate modeling results.
Let's go over the distinct steps into a scenario assessment in more detail. To begin, an assessment team outlines at least 2 or 3 qualitative distinct outbreak scenarios that could occur and identifies indicators.
Scenarios are described in terms of outbreak severity, spread, duration, and/or geographic distribution. They consider insights from previous outbreaks, such as the range of cumulative cases, duration, geographic spread, and characteristics of the disease and population, as well as the current state of the outbreak. The team then outlines a set of qualitative or quantitative indicators to broadly help determine which scenario is occurring. Indicators can include measures of outbreak growth or containment, extent and/or success of interventions, and detection of cases in new populations or geographic regions. The indicator assessment can be updated later in the outbreak as information changes. The team then assesses the current outbreak scenario. This should incorporate available evidence, including expert judgment and data as appropriate and available. Especially early on in an outbreak, there will be uncertainties, so some indicators may be challenging to determine a level in scenario 4. Note any areas of uncertainty, as they may be clarified as more outbreak information becomes available. The table on the right is an example of an indicator table, displaying a list of indicators with the currently assessed level and associated scenario, shaded in orange for each indicator. Based on the assessment of these indicators, we would likely assess that this outbreak is most consistent with scenario A. As a reminder, these indicators can be factors like growth of cases, percentage of cases identified through contact tracing, percentage of cases in isolation, vaccine efficacy, and others, and the assessment may be updated over time.